What I looked at when I designed this building was to put together a one-stop shop, an aesthetic boutique, which would have all the services provided during one day. You could come in, get your Botox, do your procedure done at the surgery center that I have on site. You can go get your hairstyling at the Jose Bear Salon. The Hanazul Med Spa will provide all the advanced treatments, as well as upstairs with a cosmetic dentist on site.
What is the difference between a facial plastic surgeon and just a general plastic surgeon? What makes that special?
All my career is dedicated to the face. This is a subspecialty. This is all I do is take care of the face. And I think that given my level of expertise, my training, my experience, that I can provide very good care toward facial rejuvenation, as I've written a textbook on how to do this.
What do you see as sort of the first thing that most 40-year-old women need?
Well, I'm going to take you back a step here. I think that a lot of people, even when they hit 30, are candidates for little tiny things, such as little fillers, a little bit of Botox. And what Botox is doing is preventing those wrinkles from forming to begin with. By the time you hit 40, what I think people are starting to get is a little bit of that tired look. And what I see that's so important, that I think is oftentimes overlooked, is a little bit of brow rejuvenation. I see a lot of people just taking a lot of eyelid skin away, and simply that just makes you look more tired. So the cornerstone of rejuvenation at that point is most likely a brow lift, which predates even a lower facelift by a good 15 years.
Tell me specifically how, say, your eye work differs from what other people do.
I think really it's my entire facial surgery that's different, and here are some examples. When I do eyelid surgery, there is no incision on the face. Everything is done from the inside. Why that's important is several-fold. One, there's no scarring. Two, the recovery is tremendously fast. Three, there's no discomfort. But four, which is even more important than all that I just mentioned, is that the eyelid position stays normal.
Say somebody comes in and they're not really ready for the big surgical thing yet. What are a few things that she can do to sort of turn back the clock a little bit?
I think a cornerstone is good skin care and also avoidance of sun exposure. Those are two big things. Botox is an incredible preventative regimen that you have to stay on. And I always say it's a regimen because you must stay on that to really get the benefits and the fruits of that benefit. And also little fillers, little things that give you a little bit more volume, a little bit more contouring before you need a lifting procedure performed.
Do you do all this here in your office on site?
Absolutely. I think it all fits back into the idea of making this ultimate makeover center so that people come through here not only can do their little things here, but they can do everything on my on-site surgery center. Everything from doing a small procedure to all the way to bigger procedures, everything done on site.
You literally wrote the book on facial plastic surgery.
This textbook is the most comprehensive textbook on the aging face and rejuvenation, and it goes back to the question you asked about what can be done. And I have everything in this book from little things to bigger things, and even my big things are not even that much of a recovery period, and that's because this is all I do. And the other thing that's important is I look at myself as much as a facial surgeon as a dermatologic facial surgeon, and I think that comprehensive nature that I can provide for rejuvenation is a very key element.
So if you decide to undergo the whole enchilada, so to speak,
Sure.
the big facelift, what are we talking about for recovery?
The chimichanga or the enchilada?
The enchilada, baby.
Okay. Well, the nice thing is my chimichanga and enchilada are about the same in terms of recovery.
Yeah.
You're looking at about a 7 to 10 day window. And even when I say 7 to 10 day window, I think a lot of people have the misconception that they look horrendous during this period of time, and they simply don't. It's very small amount of swelling that dissipates extremely quickly, and simply because I'm extremely gentle with the tissues and I'm very fast and meticulous as a surgeon, and I don't waste time, and that allows you to have a tremendously fast recovery.
The before and after pictures that you have too are phenomenal. I mean, it's
you.
just, but like you said, they don't look pulled and stretched.
Absolutely.
It's just very, it looks like probably these people looked, say, 20 years before, 10 years before, you're just turning back the clock on them.
Yeah.
Good luck here.
Thank you very
It's
much.
Fantastic.
It was a pleasure.